Starting tomorrow, Austin Travis County EMS will have fewer ambulances responding to calls. Instead, the agency launched a new program where more single paramedic vehicles will be out on the streets.
KXAN's Sarah Alsheh tells us why a recent increase in staff contributed to this decision.
Swapping out ambulances for single paramedic vehicles.
And they're going to have all of the same equipment that an ambulance would have, except that it doesn't have a stretcher in it.
Austin Travis County EMS Chief Robert Luckritz says they're launching a new deployment pilot program starting Tuesday. The agency will temporarily set aside 4 to 5 ambulances every day and use 6 to 7 of these single responder SUVs instead. These smaller units will respond to non-emergency calls and lower risk situations, while ambulances will focus on more critical needs.
They're able to go out to start advanced life support care, to get the care to the patient quickly, but also to recognize that for those calls that don't require an ambulance, that they can go out and find alternative resources for them.
Chief Luckritz says these are faster but can't take someone to the hospital.
Only about 50% of our patients actually get transported to the hospital.
Part of the reason for this shift, an increase in staffing, something KXAN recently covered.
This brings the department's vacancy rate to the lowest it's been in years.
As we bring more folks on board, there's a process of training that they have to go through. We've also had some individuals that have promoted into paramedic positions, going to school to help us fill those higher ranks. Now, we've got right around 80 individuals that are either partly or fully off the road, not working in ambulances, that are in training.
Luckritz says it's caused them to rely on overtime and calling people in on their days off. He calls this a more budget-friendly move. While this is temporary as they get more people trained and in ambulances, Luckritz says it could inspire some changes in the future.
And really identify what is the optimal number of units that we need in the field, and what is the impact on ambulance operations, so that as we look to the future and we want to grow this program, we have the data that's necessary to make informed decisions.
Sarah Alsheh, KXAN News.
And people from all areas of the department outside of ambulance operations will staff these units on a part-time basis. That includes some from the Community Health Paramedic Program, Mental Health Response Program, and Education and Training, among other things.
And just today, the medical examiner announced a 22% decrease in drug-induced accidental deaths in 2024 compared to 2023. That's the most common accidental death in Travis County. In that same time period, deaths involving fentanyl dropped by 36%. To keep fighting against fentanyl deaths, Austin Public Health also announced they have given out 36,000 doses of naloxone to city staff, county staff, and people in the community. Other efforts include training more than 1,000 people on how to recognize and respond to an overdose.